go ahead and mute your phone, and that way we don't have your background noise on the recording. But if you're in your office and it's pretty quiet, then feel free to leave it open. This can be very interactive. You can stop me at any time to ask a question. We'd be happy to have that recorded for everyone else's benefit as well. Okay, here we go. All right, so we're going to do an overview of the Colorado Storm Mapper, which is one of our most exciting mappers because we have a lot of substances that we've mapped, which is unique to our mappers. Colorado was the first one that we kind of branched out and did multiple substances. A few other states have now included alcohol in their mappers as well, but no one else has food of any sort mapped, and also, of course, not marijuana. So we'll start out by talking about why we map tobacco retail data specifically, but really any retail data. So we specialize in point of sale data, so it could be any substance, not just tobacco. Okay, Jen is here ready to join us as well. So this right here, I don't know if you have ever seen a map of this. This is the Appalachian Trail for us on the East Coast. These are the mountains. I know that if you're from the West Coast, these look like hills because there's vegetation all the way up and over the mountains. But when I was a younger adult, I hiked a portion of the Appalachian Trail, and if you look over on your left, a little circle is about to draw. That's the piece of it that I hiked, so not terribly impressive. But it was all the way through the state of Maryland. It took me 5 days, and I was with a group of 14 and 15-year-old girls. But this right here is the steps. That picture is where we started. It's in Harpers Ferry, West Virginia, is where we got on the trail. And then the entire 5 days was like an exercise in hiking up, sort of defying gravity and hoisting yourself up the mountain, and then controlling gravity as you went back down. And then you went up and then back down, over and over. Hi, Jen.
Hi.
I'm so glad you could join us. This is Lisa from Counter Tools. We just got started a few minutes ago, so we're happy to have you on. Okay, so as you hike up and down through the mountain, when you go all the way down, we call it a gap. There's lots of places on the map that are called Gap, Clark's Gap, Keys Gap, and it's a place where the mountain separates, and you can drive through it instead of trying to make your way over it or around it. When you're hiking through the gaps, you're actually making progress. You're moving from point A to point B, and you're actually getting somewhere on your trail. So the activity that's happening in the gap, the word I was looking for is actually progress. That's what's actually happening when you're going through the gaps. Conversely, at the overlooks, this is a place where you go to gain perspective. And in fact, as you're hiking along the Appalachian Trail, often you'll see a little sign that says this way with a little arrow pointing off to the side to an overlook. And if you're anywhere, I'm sure anywhere on the Appalachian Trail, but certainly if you're in the Virginia, Maryland area and it says that there's an overlook, you should definitely take the time to go to it because it's going to be amazing. This is one of the most famous overlooks in my area, my neck of the woods on the trail. But the overlook is not even on the trail. If you go to the overlook, you've actually gotten off the trail, and it's taking up time and energy to go there that isn't actually moving you along your from point A to point B. You're actually having to take a side trip. But it's worth it because of what you gain there. And the thing that you gain at the overlook really is perspective. So from this vantage point, you can look back and see the progress that you've made. You can look forward to the trail ahead of you and kind of scope out where some problem areas might be and try to strategize about how you're going to get through that, where you're going to stay the night, those types of things. So at your overlook is where you gain perspective. This is a picture of down on the ground what's happening in a lot of the gaps. So this is Clark's Gap. It's very close to where I grew up. And you'll see that there's several railroads and major roads, Route 9. There's a lot of industry. A lot of things are happening there. People are doing. You saw a picture of the overlook. No one was up there doing anything except for sort of standing there in awe. But a lot of things that happen from a vantage point or a document is created. So for instance, a map. In order to create this map, you needed to stand at an overlook or at a vantage point that would allow you to have this type of perspective. This is a picture of a bunch of the storm mappers we've made, and here's the Colorado storm mapper. This is your point of sale overlook. That's the way we like to look at it. So in order to gain perspective, so even just seeing where all of the tobacco retailers are in the state is often sort of an epiphany in and of itself. A lot of times folks haven't ever even seen the point locations of where all the tobacco retailers are, especially in states that don't have licensing. This isn't something that maybe will come in handy in your day-to-day activities and what you do, but it certainly comes in handy as a perspective gaining tool, someplace to go to strategize and how you're going to do the work that you're doing. So some of the steps that we talk about when using the storm mapper are, number one, you identify where the tobacco retailers are located in your area of interest. Number two, we're going to calculate retailer density, which we define as the number of retailers per 1,000 people. And you're going to look for swamp areas. So that's sort of a phrase that we're coining here. We got from Dr. Kurt Ribisol. And that the national average for number of tobacco retailers per 1,000 people is 1.5 across the entire country. And we've defined a tobacco swamp as any area that has 3 tobacco retailers per 1,000 people, or double the national average, which we would consider a dangerously high density of tobacco retailers. So this, to be honest, to be in a tobacco swamp area is kind of difficult. That's a high number to reach. So if your area of interest has a tobacco swamp, that's noteworthy. The other thing you can do in your storm mapper is determine the proximity of retailers to youth serving venues. And in this case, we're defining youth serving venues as schools and parks. We're going to talk today about how to download a report and the data that you can find there. One of the other things you can also do is find areas of greatest need for focused enforcement efforts. So you can look over time and see where all the retailers are that have had an undercover buy operation happen there, and whether or not they ended up selling to the youth. And you can calculate the rate of sales to minors by a series of different boundaries, whether it's by county or by school district, those types of things. Okay, so let's take a look. Here's the Colorado storm mapper. As I mentioned, you have a number of different substances that you've mapped. I'm going to see if I can get a highlighter to go. Yeah, a laser pointer. Okay, so you'll see here we have alcohol, we have tobacco, marijuana, and convenience stores that are all mapped in the tobacco in your storm mapper. In the storm mapper, you can switch from one substance to the next, depending on what you want to look at. The other thing that you have in the Colorado storm mapper is a local mapper. This was sort of our pilot test, our proof of concept for this particular mapper. We did this in Colorado, and we did Boulder County, and it's sort of shaped similar to Colorado, but this is just Boulder. And we mapped it to the block group level instead of the tract level. So you can see a little more variation within the county. It's also mapped to show just variation within the county as opposed to the whole state. So in this case, this is showing the density of tobacco retailers just within Boulder. So the neutral color is the average density inside of Boulder. And then you've got the bluer colors, which is above, it has a lower density than the county average, and the red colors have a higher density than the county average. Okay, so let's take a look at this. So we can see the tobacco retailer locations. So this is Durango. The locations of tobacco retailers really any retailer, if you look at, except for marijuana, but if you look at alcohol and certainly convenience stores, you'll see a trend. So those retailers are really great proxies for population density. So if you take a look at the state as a whole, and Colorado is interesting in that the population centers are very concentrated, and then there's just nothing. Nobody lives, very, very few people live in the majority of the state. And you can very clearly see that when you map these retailer locations. They also are a good proxy for transportation routes. If you think about it, as you're driving along a major interstate, even if you're not close to a big town, hopefully there's a convenience store or gas station when you need one. And so they follow along those major routes. So you can see here a map of Durango, Colorado, and this is just the point locations of each tobacco retailer. If you click on any one of those points, a little pop-up box comes up to show you the name and address of that retailer. All of these retailers were geocoded from a list we acquired from the Department of Revenue. Geocoding is not an exact science. It is typically much more accurate in urban areas, and as you get out into very rural areas, you may find some more error. But that's not to say that in the urban areas it's always perfect either. But it does a really good job. Colorado Springs, you'll see the density of tobacco retailers is mapped here by census tract, which is a decent proxy for neighborhood. So census tracts are usually drawn to include 3,000 to 6,000 people, and the tract boundaries are drawn to try to enclose a homogeneous population. So these are sort of like areas, and so they're a decent proxy for neighborhood. So you can see areas where the red areas have a higher density, the blue areas have a lower density. The other thing you can take a look at in the Colorado Mapper is the enforcement checks. So over here on the far right side, we have Wheat Ridge. It's a suburb in Denver, and you can see the compliance check locations. Not every single retailer is checked every year, so it's not every single retailer in the Wheat Ridge area, but the ones that were checked during this time frame are shown on this map. So the green ones are the retailers that were checked and did not sell to a youth. Yellow ones sold one time, and the red ones sold 2 or more times to a youth. So often if they have an undercover buy and they fail it, they sell to the youth, it'll trigger another one, and they'll just keep going back. In this case, if you look at the map closely for Wheat Ridge, you'll see that some of them have a black dot in it. Those that have a black dot in it were SINAR checks specifically. The others were just state-run checks, so state enforcement. Okay, so this is one of the story maps that we found in the Colorado Mapper that we have literally told all across the country. You may have seen this series of slides before, but it's an excellent illustration of how the Mapper can uncover stories in the data that may be compelling and certainly something to present to policymakers that may actually garner some support for tobacco change. So here are 2 areas of Denver. So a suburb is Commerce City, and then I believe that that's actually its own thing. And then South Denver, I don't know if that's its own thing. I think it might just be a suburb of Denver. But 2 sort of outlying areas. If we look at Commerce City, we zoom into a high school, and this one stuck out to me because at this point when I found this, I had never seen any school that had this many tobacco retailers within 1,000 feet. So you see the pink buffer area is my 1,000-foot buffer. The blue dot with the school in it is Lester R. Arnold High School, and then all of the dots are tobacco retailers, and they're red because they fell within my buffer area. There are, if I zoomed out, you'd see a bunch of green ones that are not inside any buffer, but these are all inside my buffer area. In this particular neighborhood, the median household income is pretty middle of the road. The percent of families in poverty is on the high side. The telling factor in this case was race. This is a predominantly Hispanic neighborhood. And the nearest retailer, I actually measured it, was 488 feet from the high school to the nearest retailer. And I'm sure you've seen these slides from other webinars, but the reason we care about this is because proximity to retailers matters, and research has shown that youth go and spend their money at convenience stores much more than any other store. And convenience stores, certainly if they were going to buy food, they're going to run into a convenience store as opposed to a grocery store or Costco, something like that. And convenience stores have far more tobacco advertising than any other tobacco retailer. So they are exposed to the tobacco marketing more in those types of retailers. And the frequency with which they are exposed to that type of marketing triggers a relationship that they start building with brands. So research has shown that students who go to school with a tobacco retailer within 1,000 feet are more likely to become ever smokers than students who do not. So their prevalence rates go up. So we care how close retailers are to places that youth frequent, such as schools. And you'll see here that all of the retailers around this high school are convenience stores. I'm not exactly sure what a Save-A-Mat is. One of you can jump on and tell me if you know what that is. But I don't think it's a full-service grocery store. Certainly the rest of them are sort of smaller type convenience stores, or stores that are easy to run in and run out. This is a picture from their high school, and you can see the demographic of it being predominantly Hispanic is certainly represented in the picture there. Conversely, this is Denver South High School. This is the neighborhood that's south of Denver. And here's my buffer, my pink buffer area that's being drawn around both that park and the high school. And you'll see that there are no dots on my map, and there aren't any coming. There just aren't any retailers even anywhere near here, much less within 1,000 feet of the school. And the demographic is probably not surprising. It's a very high income, low poverty, and predominantly white neighborhood. The nearest tobacco retailer was over half a mile away. So in addition to knowing that proximity matters and your exposure to tobacco marketing changes your behavior, certainly if you were trying to quit, you are half as likely to be able to quit if you live within, I think it's 250 meters of it's 500 meters of a tobacco retailer. So students that are trying to quit, if they go to Lester or Arnold High School, have a lower chance of staying quit than students that are going to Denver South High School. It changes your behavior. It changes your perception. If you see the marketing all of the time, that's another thing that research has shown. It changes their perception of how accessible it is and how much other people are smoking. They think everybody smokes if you see tobacco marketing all the time. Students that go to Denver South High School, it's nowhere even near them. So they don't think it's accessible because they never see it, and no one's smoking. Because people around here, if they tried to smoke, they were more successful at it because they're not being cued to smoke all the time. And because of the difference in the neighborhoods, we can see that there's a disparity happening here that's reinforcing a trend of that if you are lower income or higher minority, so our disadvantaged populations, end up smoking more. Partially, you could argue because they're being way more inundated with tobacco marketing than our high income, predominantly majority race or white neighborhoods. These are some photos from their high school website. Okay, so another thing we can talk about is FDA inspections. So a lot of states now have an FDA contract. The FDA is checking two different things. They go in and do the undercover buys, just like the SINAR and the state inspections do. They also are checking for advertising and labeling violations. So if people have self-service tobacco products if they're selling loosies, so if they open up a pack and are selling individual cigarettes. There are a number of different advertising and labeling violations that they might have. So we'll take a look at Denver. Again, you'll see that we've calculated the rate of violation, and we've got 3 areas that kind of stick out as areas that have had 5 to 9 violations in the Denver area. So this is our highest violation rate in Denver. And let's take a look at just spatially, looking at the reference map that's underneath, which is it's a Google map. So when you go to the mapper, hopefully you'll feel very comfortable there. It's a Google map underneath, and it behaves just like a Google map. If you zoom in, scroll your mouse up or down, pan either side, it's just like a Google map. But if you look at this area, if you'll see right here, there's Coors Field and the 16th Street Mall are very either neighboring or right inside this area where we've got some violations. So some high sort of recreational entertainment areas, and certainly areas that youth go to, are sort of youth magnets. This one, it's not quite as close, but the Denver Zoo is near this area. And in the last area, you'll see that the Cherry Creek Shopping Center is right in the middle of this other area that had a high number of FDA violations. So inside the mapper, this was just looking at the reference map below below sort of our spatial analysis layer, and trying to see if we could find any correlations between the information that we mapped with the FDA violations and why those areas may be areas that have an FDA violation rate that's higher than the rest of the city, or just seeing what else is there that might be affected by it. Okay, so we're going to do a quick live demo of, so here's your mapper website. You'll see over here we've got alcohol, tobacco, marijuana, convenience stores, and then you have a tab here that will show them all together. So I wanted to show you the convenience stores. This is a tab that just went live in January. So this is a map of all of our convenience store locations. I can show what my density of convenience stores is by county, or by any of these. We call these calculable boundaries. So if I take a look at by census tract, I turn the layer off. So I'm not sure that this is surprising to you or not, but we know that our population center runs right around here, so we've got a lot of variation throughout Denver. Over here you'll see the airport, so there's tons of convenience stores because of the airport, but not very many people live there. So when you talk about calculating number of retailers per 1,000 people, those 1,000 people are residents of that particular census tract. So since there are very few people that live in this census tract because of the airport, it comes up as a really high density. So it's a little bit of not a mistake in the data, but you would just have to know how to read it. But certainly down here, we've got some really areas of high density of convenience stores. The other thing that we added is a count. So you can count the number of retailers of convenience stores per county or per school district, any one of these areas. You can calculate it and figure out exactly how many are in there. And then you can download a report to get a list of all of those retailers, either by any one of these boundaries. So I can get a list of all the retailers in a city, a county, a school district, any of these calculable boundaries. The other thing we can do is figure out which retailers are within 500 feet, so which convenience stores are within 500 feet of another convenience store, or which convenience stores are within 1,000 feet, and I can choose different distances depending on if I'm in a very urban area. Maybe 1,000 is just too much. But if I'm in a very rural area, it might not quite be enough. Of a school, a park, or both. So let's take a look at stores that are within 500 feet of another. So these are areas, stores that are like right up on top of each other. And you see that a lot, especially with convenience stores, a gas station on every corner at a major intersection. And one of the things folks talk about, one of the policies that we hear folks talking about would, for instance, are to set a policy that says if you want to open up a new tobacco retailer or a convenience store, it cannot be within a specified distance of another retailer. So you'll see that each of the retailers has a circle drawn around it. This is our 500-foot buffer. And in this case, we've got a cluster here of 4 retailers, some of which they're not all, well, I think they are. I think these are all within 500 feet of each other. So those retailers are all very close to each other. And then the green ones don't have any retailers inside of their buffer area. So again, when you think about food is definitely more complex. It's an issue that we've kind of wrestled with. Any kind of food is better than no food at all. But when you have choices, then there are definitely good, better, best choices to be made as far as food goes that certainly affect your health. And obesity is, a huge health concern. And the nutrition folks there in Colorado are specifically working on convenience stores and trying to get healthier options in convenience stores.
And that's where did the convenience store data come from?
The convenience store data also came from, so the convenience store data came from a couple different areas. Some counties had their own list that they had been cleaning and keeping up with as far as food retailers go, but not every county had that. And so we had a master list from the Department of Revenue, and we replaced the data in those counties that had their own. So we replaced the Department of Revenue data with county level data for the counties that had their own data.
Right.
So here you'll see the same buffer again, drawn around schools and parks, and you'll see the convenience stores that fall within that 1,000-foot buffer. And again, I can change the buffer distance to, whichever 500 feet. You can change that to see which stores fall inside of that area. And then lastly, just like in the other substances, you can get a report. So I can get a convenience store report, which when you see that one, you should think density measures and then your proximity analysis. So it's just, I already actually have that one open. So here's my density measure for my density report for convenience stores in Denver County. So it tells me my total population. I have 233 retailers. I have 0.38 retailers for every 1,000 people. So interestingly, that's a lower density than the tobacco retailers. And then the number of people per retailer. The number of convenience stores within 1,000 feet of a school. So 27% of my retailers are within 1,000 feet of a school. And at least in the world of tobacco, that's exactly the number that we shoot for. We try to get around 30%. When you think about a policy, there are lots of things that are restricted from being around schools. You can't have a liquor store that close to a school. You can't have, at least in most states, you can't have a strip club. You can't have gambling. You can't sell a gun. In most states, they have a lot of things that are restricted from being within 1,000 feet of a school. So if you were to try to gain support for a policy that says you can't sell tobacco, or in this case, you have to be equally providing access to healthy foods and not just junk food within 1,000 feet of a school, however you were going to frame that, the work it would take to pass such a policy is only worth it if you're going to affect, we think, around 30% of your retailers. At 500 feet, you might be getting only 10% or 12% of retailers, and you wouldn't necessarily be affecting enough retailers to make any difference. So this is exactly the sweet spot that I think you look for. If you scroll down, you'll see that I can also generate from this report a list of all of the retailers, in that particular area of interest. So in this case, we chose Denver County as our area of interest. And this is where I get a list of all the retailers that are inside of there with their name and address. And where the data is not complete, that the list that we got from the Department of Revenue just didn't include, it was not always complete. Again, over here on the
Lisa,
side, yeah.
Hey, can you say more about the 30% piece? And I guess my question is, 30% of the total convenience stores within a defined area? Is that what you're talking
Correct.
about? Or okay.
Yes, that's what I was talking about. So when you think about trying to affect a change, so if we're going to say I want tobacco retailers, let's see, let's say we were going to ban tobacco sales within 1,000 feet of a school. Well, if banning tobacco sales within 1,000 feet of a school only changed 6% of my retailers, that I only affected 6% of my retailers, it's not really changing my point of sale landscape, my tobacco point of sale landscape very much. And the amount of effort that it would take to pass such a policy would not really be worth it if you didn't affect a large enough change to your point of sale landscape. Does that make sense?
Yes. So my question is, how do I operate in more rural, less populated communities that still have,
Right. You make a bigger buffer. So you can test to see which one of these gets me closest to that sweet spot. Does that make sense?
Mm-hmm.
So now, instead of saying 1,000 feet, I want to see how many retailers, what percentage of my retailers are within a half a mile. And is that closer to my sweet spot?
So if there's only 3.
Correct. So if
even in a half mile area, although it really covers a complete county, and I have a county working on point of sale, then how would you advise for them to begin to think about that work? Is it worth the effort at that point, or are we talking about just sort of rethinking about how we?
Yes, this is something I've been thinking about for a while now, and it got triggered when we started working with Colorado because I'd never mapped a state like Colorado before, where everyone lived in a couple spots and then no one, very, very few. It was like wildly rural everywhere else. But since then, we've done 2 other states that are just like Colorado. Vermont is exactly the same, though of course much smaller, and now we're working in Arizona, which is also exactly like Colorado, where you've got a couple population centers. And so I've been thinking about the rural issue a lot. And one of the measures that I didn't pay as much attention to, but that we already calculate, is this one right here. When you look at the number of people per retailer, I think in rural areas that number might be a key number for you. So when you are in a very urban area, the number of people per retailer is going to be lower, right? Because I've got a ton of retailers. But when you think about rural areas, so instead of trying to get the sweet spot of a percentage of my stores, and there are some counties in Colorado that, literally they have like a handful of retailers, period. So to get 30%, maybe you only have to do 2 stores, and still that's ridiculous. So if you only have a handful of retailers in your entire county, I feel like at that point you're working on all of them, because the number you're worried about or the number you're thinking about is how many people, if I change this one retailer right here in the middle of my very rural county, I'm going to affect a ton of people, because there aren't very many options of where these people can go to purchase alcohol, to purchase tobacco or any of these substances. They don't have as many options. So I'm going to affect a huge change in my point of sale landscape by only changing a couple of stores. I don't have that many retailers, but I can change what the marketing landscape, what the point of sale landscape looks like by changing the whole county, because there aren't that many retailers. Does that make sense?
It does.
Okay.
Thank you.
So I feel like there's like a huge opportunity in rural areas to affect the same amount of people as and to improve the point of sale landscape and the effects of marketing, all of those types of things, just as much as there are in urban areas. They're not working on a percentage of stores. They're working on all of them.
Right.
Good question. It's something we're still thinking about, something we'd love to hear feedback from the folks that you have, like the boots on the ground folks, of learning more about sort of the reality of the truly very rural areas. But that's something that we think about a lot here and are working to improve our measures so that we make sure that all of this is very applicable to them. But I think the people for retailer is a good measure for them.
Thank you.
Yeah. Any other questions? Just another quick, so over here under health, under the convenience stores, we've included a number of layers that we got from the Burfus data. And I guess this isn't, the behavioral health data, and this is the youth behavioral health data. So we have, I'm going to turn this layer off. If you click this house button, it always takes you back out to the full state. And so we can look at childhood obesity rates, and this is by region. So the youth, the minors, the children, and the high school is by health region. The adults are all by county. So I guess it wasn't quite as, or maybe it's by school district. It's not as sensitive, the data that we're reporting about adults. But you've got obesity, overweight, low fruit consumption, low vegetable consumption, and high sugar sweetened beverage consumption for children, high school students, and adults. The other thing we included is this Murphy Index, which is a measure showing sort of a converse relationship between I live in a food desert versus an area that has, it's a measure of both high fast food, unhealthy consumption, and low health. So high fast food, low healthy foods. So areas that don't have a full service grocery store and have tons of fast food restaurants are going to mark high. Areas that have a lot of fast food restaurants and several full service grocery stores are going to be middling, and areas that have farmers markets and several full service grocery stores and not a lot of fast food are going to register as low. And there's documentation to help you sort of understand the Murphy score better. But knowing what you know about Denver, I'm making a wild assumption that you would be more familiar with Denver. So here's Commerce City. We've already looked at Commerce City, and it's measuring high on the Murphy Index, so lots of fast food, not as much full-service grocery stores. And so we know that this area is a lower income, higher minority area versus South Denver, which is somewhere in this area-ish. And it's measuring as blue, which is lots of full-service grocery stores, healthy food options, and not as high a density of fast food. In addition to those layers, we, of course, still have the demographic layers where you can take a look at median household income for the state. And you would not want to do it over top of the health data. So again, we've got our median household income, and then you can see different race, ethnicities, and also age. Age is one that we've recently added to take a look at whether you start seeing higher density of any one of these substances in areas that may be targeting young people. I think it's especially applicable to the tobacco industry that has a history of targeting youth. One thing to note, as you look at these maps, the white color is always indicating the population most at risk. So my highest percent of young people is my lightest color, is the white color. The dark is my lowest percent of young people. So the white is always my population at risk. It is white to dark, highest to lowest, if you see over here on the left. For all of these, this is the median household income is the only one that it flips because my population at risk is my lowest income, not my highest income, so it flips over. So it's something to keep in mind. It's a little bit counterintuitive. It took me a little bit to get used to looking at it this way, but after flipping it back and forth repeatedly, our team finally decided that this was actually the best way to visualize the data. It just takes a little getting used to in terms of seeing white as my highest percent of whatever my population at risk is. Also with this, we have included here links to, if you look over here, I included the average for the highest bracket. So this is 57.6% is my average for this highest color and my lowest average. But if you want to know the exact breakpoints for all of the categories, you can click on this little I button and download the exact number ranges here. You can also click here to get all of the census data that we used for this, for your mapper. It came from the American Community Survey. And it's at the tract level. Because it's the American Community Survey, it's not a 100% sample, and so it has a margin of error for each of the variables. And so this document, this Excel spreadsheet, includes the margin of error for each of the variables, so that you can go back and take a look at that. It's full disclosure of all of the data, and you can take a look at what the limitations are there if you want. The last thing I want to show you is the help. You'll see right here there's a link to open up the user guide. It's a PDF. So if you come to Mapper and you forget how to do something you want to do, how do you download a report, how do I get a list of retailers, it'll walk you through all of the features in the Mapper and show you how to use it. So that's right there for you to use. Any other questions? Thoughts? Anything I can answer? Well, we hope that
Lisa,
you find the tool. Yes, please go ahead, Dan.
One question. I'm sorry. You defined a swamp earlier. Can you give me that definition again? Sure.
So a tobacco swamp, and I'll go ahead and show you one. So tobacco swamps are any area, and it's written right here. So any area that has 3 or more retailers per 1,000 residents. Because the national average of retailer density, or number of retailers per 1,000 residents, across the entire country, the national average is 1.5. So we got 3 by just doubling it. So this is twice the national average for any area that has a dangerously high density of tobacco retailers.
Okay.
And so you'll see that inside of. Go ahead.
You also mentioned you were looking at Cherry Creek and the FDA violations. And you mentioned that you had looked at different or other variables that might have influenced sort of the higher violation rates. I'm wondering if anything came of that, or if what were the variables maybe that you looked at?
So the variables. So here's the FDA violation rates. Here's Denver again, and you'll see that I calculated it my rate of violation by census tract. And you'll see that I only have a couple of census tracts that popped out as having a higher rate than the rest of the city of Denver. And I didn't, so you can turn on and off any of these layers to take a look at how they may or may not correlate with different areas. So just doing your own little visual spatial analysis. So where are my shopping malls in relation to this? And look, 2 of my shopping malls are right either next to or inside of these areas of higher FDA violation. I don't think I'm going to have any ski areas in here.
No.
We can take a look at parks. We've got one that has this nice park going along here. And then really I just zoomed in. And the Google map in the background here has all this reference data, right? It's giving me my street names and stuff. And I see that Coors Field, and I remember driving by that when I was out there, is right here inside of this. And so it just gave me the idea to look and see if there were other things inside of these areas of higher FDA violations that might be youth sort of pulls or youth magnet areas. So this area has Coors Field and then the shopping mall. This one didn't have anything in it. There's a high school right next to it, and the zoo is up here. I don't know if that was enough of a correlation or not. This one has a Cherry Creek Mall right inside of it. So some of it's just doing sort of your own investigative work, turning the layers on and off that we've got. We could also take a look at it not by, we could also take a look at if there was sort of an income thing going on here. So here's my median household income, and let's see where are my areas. So it's down here, it's here, and it's up here. So we got all different kind of income. So it doesn't look like that's really a factor going on here. But so you just kind of, especially for folks that have a really defined area of interest. So when I look at the mappers, I'm looking for good stories across the entire state, and so I just start systematically going through and looking for a couple specific things. But if you have a really specific area of interest, then you can really just concentrate your efforts on turning stuff on and off and seeing what the stories are that you can find in there.
Okay. Great.
Excellent. I think that's all we've got. If nobody has any other questions, I appreciate your time. We love to get feedback from users if there are things we can do to help make this tool more useful for you. I'm going to send Nina all the links to the different websites so that you can, everyone has the links, so we'll send them out again to make sure that everyone can find them. But we welcome any feedback anytime. And certainly if you run into a bug, please don't hesitate. My email is very easy. It's just lisa@countertools.org. And we look forward to our continued work together. Thank you so much, everybody.
Thanks, Lisa.